HIM-135, Chapter 14, Endocrine System Diseases and Disorders. Anatomy and physiology. The endocrine system glands include the hypothalamus, pituitary, pineal, thymus, thyroid, parathyroids, adrenals, pancreatic islets, and ovaries and testes. Each has a unique function and delivers its secretions as needed into the bloodstream. The hypothalamus is located in the third ventricle area of the brain. It secretes hypothalamic hormones that regulate the function of the anterior pituitary gland. The pituitary gland is divided into two parts. The anterior part produces several hormones that affect other endocrine glands, and the posterior part stores oxytocin that helps the progress of labor in the pregnant female and causes uterine contractions after childbirth, and vasopressin that affects the reabsorption of water from the renal tubes. Pineal glands are located behind the midbrain and they secrete melatonin. Thymus gland is located just below the clavicle behind the sternum. It secretes a hormone that stimulates the development of lymphocytes. The thyroid gland is located in the neck on either side of the trachea. It secretes hormones that are released as needed in response to the thyroid stimulating hormone secreted by the pituitary gland. Parathyroid glands secrete parahormone that is important in the regulation of calcium and phosphorus in the body. Adrenal glands are located on top of each kidney. They have two distinct parts, the cortex and the adrenal medulla. Beta cells are located in the pancreas. They secrete insulin, which is most important in the metabolism of glucose. Ovaries secrete the sex hormones estrogen and progesterone, and testes secrete the sex hormone testosterone. Common signs and symptoms. Most endocrine disorders are due to hypo or hyper gland secretion, so too much or too little. Signs and symptoms include mental abnormalities, lethargy, and tissue atrophy. Diagnostic tests. The thyroid glands and the testes are the only endocrine glands that can be physically examined. Assessment of the function of other endocrine organs is accomplished with blood or urine testing for the hormone that they produce. Pituitary gland diseases. Hyperpituitarism is an abnormal increase in the activity of the pituitary gland. It affects growth hormone production, leading to excessive growth of bones and tissues. Before puberty, giantism occurs. In an adult, acromegaly or extremity enlargement occurs. Hypopituitarism is abnormal decrease in the activity of the pituitary gland, leading to a deficiency or an absence of any or all of the tropic hormones. This can cause dwarfism. Diabetes insipidus is characterized by excessive thirst and polyuria. Two types of diabetes insipidus include central diabetes insipidus, which is pituitary related, and nephrogenic diabetes insipidus, which is kidney related. Polydipsia or excessive thirst is a common symptom of diabetes insipidus. Thyroid gland diseases. Hyperthyroidism is overactive thyroid. The distinguishing characteristic is exophthalmos, which is an abnormal protrusion of the eyeballs. Simple goiter is enlargement of the thyroid gland. And hypothyroidism is a decrease in normal T4 production. And it's commonly caused by an autoimmune disorder called Hashimoto's disease or the result of medical treatments. Parathyroid gland diseases include hyperparathyroidism, an overproduction of parathormone by one or more of the four parathyroid glands, and it causes hypercalcemia. And hypoparathyroidism is a decrease in the normal amount of parathormone secreted, leading to abnormally low blood calcium levels. Adrenal gland diseases. These diseases are often treated with cortisone, which acts as an anti-inflammatory agent. Conn syndrome is due to an overproduction of aldosterone, affecting blood volume pressure and electrolyte imbalance. Cushing's syndrome is an overproduction of the cortisol glucocorticoid. Symptoms include a round moon-shaped face, fatigue, and striae, which are stretch marks. Androgenital syndrome is an overproduction of sex hormones by the adrenal cortex. It's also known as adrenal viralism. And one of the symptoms of this is amenorrhea, which is absence of menses. Hypoadrenalism, also known as Addison's disease, is an uncommon undersecretion of hormones by the adrenal cortex. It's caused by an autoimmune disorder, tumor of the pituitary gland, tuberculosis, and prolonged steroid hormone therapy. Pancreatic islets of Langerhans disease. The pancreas is both an exocrine and endocrine gland. As an exocrine gland, it secretes digestive juices through ducts into the digestive system. As an endocrine gland, it secretes insulin and glucagon, which raises the blood sugar. Diabetes mellitus type 1 is formerly known as insulin-dependent diabetes or juvenile onset diabetes. It requires daily insulin injections. Diabetes mellitus type 2, formerly known as non-insulin dependent diabetes or adult onset diabetes, is controlled with diet, exercise, and oral and/or injectable medications that stimulate insulin secretion. Management is tested by measuring glycosylated hemoglobin, which is abbreviated as HbA1c. Gestational diabetes occurs only during pregnancy, with blood sugars returning to normal soon after delivery. And hypoglycemia is abnormally low blood sugar. It occurs when the blood glucose level drops below 60. Reproductive gland diseases. Hypergonadism is increased hormone production before puberty. It produces precocious sexual development in both sexes. Hypogonadism is decreased sex hormone production by the age of normal puberty. And finally, effects of aging on the endocrine system. Decreases in the secretions from the glands alter the body's ability to respond to stressors, diseases, and other changes, which causes issues. And digestive and metabolism problems are common due to reduced secretions of pancreatic and thyroid hormones.